Well, hello there, everybody. It's Dr. Steve with Kineci, and this is your Understanding Your Pain. Today, we're going to talk about a hip labrum issue. And so the labrum is a part of the hip joint, and let's zoom in just a little bit here. And so the labrum is a rim of tissue that goes around the edge of the socket, and it's kind of like a gasket that comes and makes the vacuum seal around the head of the femur here. As the ball and socket joint, the ball comes into the socket, the labrum is right on the edge of the socket to come down and attach to make the vacuum sealed joint capsule. But it's considered a fibrocartilage tissue. So it's kind of like cartilage, but it's not totally cartilage, but it's a fibrous, tough, dense kind of tissue that doesn't have a great blood supply. And so it's one of those things that can take a little bit of time to heal, but it is possible to heal. Now, symptoms that often happen is most of the time it's on this anterior, kind of superior anterior part that gets pinched. And when we do things like rotate, internally rotate, that's where this inner edge gets pinched. If we adduct the leg, that tends to kind of pinch it, and sometimes if we flex. And so the tests, the orthopedic tests, looking at if the labrum is involved, usually involve a flexion, adduction, and internal rotation, that combination is going to pinch those tissues the most. And so what we want to do is we want to open up this area. When there's a labrum issue, there tends to be a lot of congestion in here. And so our world of sitting is one of those things that contributes to a lot of congestion in the front. And so as we sit, it's very much like kind of gathering the folds of the fabric in the front, and you go to stand up and it can be tight and tugging on all of this stuff. So the hip flexor and then the groin muscles, the inner part of the hip, those get really tight and congested. And that's a big part of putting some of the strain on that labrum. But the body is a big connected machine, and that's the stuff below. Above it are the abs in the ribs. And so one of the things that happens with all of our sitting is we tend to slouch. And we as humans are very good at slouching and are able to slouch on almost any surface, but it's kind of that rolling back and the front just kind of collapses down. And a lot of that tightness, again, it's like grabbing all the folds of fabric together and gluing it together. And then you go to stand up and all of that is just really tight. We want to be able to lengthen through that because tightness in the abs can contribute to putting extra tug on the labrum. So something like traditional crunches, where you're laying down on your back and your knees are up and then you're shortening through the abs, that's something that tends to actually add to strain on the labrum. So those are not really recommended for many reasons. It's not always the best exercise for your abs, for your low back, but also for a labrum issue. So that's to give you a little bit of understanding, and the strategy that we're going to go after with our parts 1, 2, and 3 today is we're going to lengthen through the hip flexor and the groin. That's the first part. We're going to lengthen through the abs and the trunk, and then we're going to do a lengthen to strengthen, where we're going to add some strength and stability to all of this stuff around here, kind of the front, the core, the hips, the pelvis, but we're going to do a lengthen to strengthen kind of approach to it. So let's get into the first part. The hip flexor stretch. This is one of my favorite go-to stretches. It's one of the best anti-sitting stretches, but this is where ideally using a chair in a doorway, you can do this without a chair, where you just stand with one foot forward, one foot back, and we want to get this hip into extension so the femur is coming back behind the body. The foot onto the chair makes it a bigger stretch. And so if you're in a situation where having your foot up onto something isn't as convenient, maybe at work, or maybe you're traveling. Then you can just kind of stand with 1 foot forward, 1 foot back in this stride stance and be able to do the different directions that we wiggle the hips. But if you are able to put your foot up onto something like a chair in a doorway or at the bottom of the stairs, putting your foot up a couple of steps is another convenient place. But what we're going to do is lengthen through the hip flexor, and we're going to drive our bodies and hips in the 3 directions that we do. We're going first forward in the sagittal plane. Then we're going to do the side to side in the frontal plane. And let's do rotations in the transverse plane. So for this version, I'm going to have you twisting back and forth through the pelvis and through the body. So I usually like to give you a second angle to be able to understand how that all plays together. So we'll do it this way so that I can hang on and not fall over. And if you can hang on to something else here or the wall in front is good. But this is where we have the toes lined up, and you can see kind of with the piece of tape here, we have the toes lined up, pointed forward. The back heel is staying down. We're taking our hips forward and back. We do some side to side. And the side to side and the twisting are where it really makes a difference to hang on to something. And then we'll do the twist around the corner. So that targets the hip flexor. Now, here's the beauty of it. We do one little tweak to the position and we're going to get more of the groin. So for this, the big difference is the foot goes up onto the chair, but now my bottom foot is pointed out 90 degrees. And again, this grid gives us a great reference point for you to be able to see my foot is turned out 90 degrees compared to the one that's on the chair, and that's going to expose the inner part of the groin and the hip and those adductor muscles. Everything else gets to be the same. We take the body and the hips and we do our same 3-direction formula. We do the forward, we do the side to side, and then we can do the twists and the rotation where you're trying to turn through the pelvis and the body. So again, I'll give you the other leg from the other view so that you can kind of get the idea. Bottom foot is now turned out 90 degrees. The front foot is kind of pointed forward. We're hanging on again. The hips go forward and back. We go side to side. And then we do the rotations. And where I have my hands is a little bit limiting for my rotation on this side, but that's the idea. So those two together really work the front and the medial side of the hip and the groin. It lengthens through, opens up all of that stuff that gets really congested with lots of sitting, that tends to pinch and create congestion for that labrum issue. So that's a starting point. Be sure to tune into parts 2 and 3 to find out where we're going next as we're building more length, and then we're taking it into the lengthen to strengthen integrated kind of approach as we get to part 3. But if you or anybody that you know, a loved one or somebody you care about in your world, is struggling with some hip pain, has a labrum issue or some other issue that they're just not figuring out, send them into Kineci, let us figure it out, help, and come up with an individualized plan to get them feeling better and functioning better. So until next time, bye-bye everybody.